The CDC's decision to change its guidance on wearing masks has many people asking what's changed from 2 months ago.
And the answer is the dominance of the Delta variant. Our Dr. Frank McGeorge here to explain what's so different about Delta and how it impacts everyone. Hi, Doc.
Hey, Sandra and Jason. Yeah, at the heart of this decision by the CDC is the question that so many have asked. If a vaccinated person suffers a breakthrough infection, are they able to infect others? Well, when it comes to the more contagious Delta variant, the CDC says new research shows the answer is yes.
I have seen new scientific data from recent outbreak investigations showing that the Delta variant behaves uniquely differently from past strains of the virus that caused COVID-19.
Here's what's different. With previous versions of the virus, those who were vaccinated but still caught COVID appeared to carry less of the virus in their noses and throats, making them less likely to infect others. But the CDC says new data on the Delta variant finds vaccinated and unvaccinated people with COVID have nearly the same amount of virus in their noses and throats. That makes it more likely a vaccinated person could be as infectious to others as an unvaccinated one. That's the reason masks are now being recommended for everyone in areas with substantial and high rates of COVID-19. This does not mean the vaccines aren't working. They remain highly effective at preventing serious symptoms, hospitalizations, and deaths. The vast majority of infections continue to be seen in those who are unvaccinated.
Vaccinated individuals continue to represent a very small amount of transmission occurring around the country. This moment, and most importantly, the associated illness, suffering, and death could have been avoided with higher vaccination coverage in this country.
Now, Michigan currently has a moderate rate of transmission, which is below substantial or high, but as cases are ticking up, there's great concern about what we're going to see here, especially as we head into fall. Now, if you are still on the fence about getting vaccinated, this would be a great time to have a serious discussion about it with your doctor or another trusted professional.
Yeah, very good advice. And Doc, does this mean vaccinated parents could actually pose a greater risk to their kids who would be unvaccinated, maybe even greater than we thought previously?
Well, yeah, Jason, actually the short answer is yes. If you live with people who cannot be vaccinated or who are immune compromised, it's reasonable to be more cautious about your risk of exposure, even if you are vaccinated. For example, that might include wearing a mask in crowded indoor places to keep your vaccinated self from getting infected and transmitting it to someone at high risk that you're associated with.
Yeah, and symptoms not being as bad, you might not even know that you're infected. Boy, a lot to think about. All right, Doc, thanks.